Hi, thank you for joining me today.
Hi, how are you?
I'm good. Well, for everyone out there, I am Kate with Scottsdale Moms, and today we have Arcadia Pediatric Dental with us, and we're going to go over just some awesome information for moms. Feel free to go ahead and introduce yourself and tell us a little bit about the practice.
Hi, I'm Alli. I am one of the pediatric dentists at Arcadia Pediatric Dental. There's actually 3 dentists that work here right now, me, Dr. Wallace, and Dr. Coffin. And we are excited to share some information with you today.
That's great. That's great. Well, I know in our moms neighborhood groups, one of the most common questions we get is about, when do you start care? When do when do you go to a dentist? All those things. So I would love for you if just walk us through some, frequently asked questions that you get from the moms out there.
Yeah, of course. So a lot of people are actually really nervous about their first visit because they're not sure when to come, how their child's going to do, things like
Right.
that. So I would say we always recommend coming to see the dentist by about age 1, as soon as you're starting to get teeth, because there are some things that we can talk about before you even have teeth, just to prepare you for what's to come. We also can give teething tips, things like that, and just take a look around and kind of figure out specific to your child. What our recommendations would be. And everybody gets really nervous about how their child will do, but I will say coming to a pediatric dentist, it should be fun. It's high energy here. It's not the dentist that you're imagining from when you were a kid.
That is so great. My oldest now is 21, and I wish I had known, back when she was little. I really thought like age 3 is when you started. And so I really didn't know that till my second one, that you start pretty early with them with teeth care and showing, getting them used to the feel of even just brushing gums and things like that. It's such great advice.
Yeah. And it is important to note, it's never too late.
Yes.
If you're 3,
yes. Bring them in.
bring them in. Yeah. And even if you're a little small baby, what we do is we keep the kids on their parents' laps for the first couple of visits. You don't have to be even ready to sit in the dental chair. So for the first couple of visits, until they get more comfortable with us, that's what we do. We have what's called a knee to knee position. So the parent will face us, and then we'll lean the child back into our lap so that they see the parent the whole time, so that there's a familiar face, even though there's a lot of things that are going on that they don't know anything about.
Yeah, I love that.
And we have little tricks like TVs in the ceilings to distract them, and little toys and things like that. But the first couple of visits, especially if you only have, a few teeth because you're a little itty bitty baby, they go really quick. We introduce toothbrushing early with like a little toothbrush that's not the spin brush that we generally use at the dentist, just to keep it a little easier for them. We'll go over how to brush your teeth. We'll give you some tips how to make it easier if you've got kind of a wild child, which a lot of people do.
Yes. That, time frame of brushing teeth suddenly feels like 20 minutes when it should be just a little, because they don't want to.
And that's another important thing that I always like to mention. I mean, our recommendations are one thing, but when you get home, the expectations are a little bit different. I mean, I have kids myself, and it can be like wrestling a tiger to brush their teeth. You just have to get in what you can get in. Ideally, we want to brush twice a day, once in the morning, kind of after breakfast. Some parents even like to do their morning brushing right before the longest nap if you have little ones, just so you have that much time where they're not eating or drinking anything, to let that clean, healthy mouth, sit. And then at nighttime, right before bed, try to make brushing and flossing the last thing you do before you go to bed, and just have water after that. And even if you can leave your toothpaste on your teeth for about 30 minutes without drinking anything, there's some protective minerals in that toothpaste that will help soak on the teeth, that the longer you can leave them, the better off they'll be. And a lot of parents are concerned about kids swallowing their toothpaste too.
Yes.
So under 3 years old, if you want to use a fluoride toothpaste, you can skip baby toothpaste altogether. You can just
Okay.
if you want to use a fluoride toothpaste, and just like a little grain of rice size, just kind of barely a smear, barely squeeze it out of the tube, and just kind of get the bristles wet with it. It's safe to swallow that twice a day. You don't have to worry about a young one being able to spit out their toothpaste. You don't want them eating the tube either, but it's safe to swallow that little amount. Once they're over 3, you can start doing your pea size amount, and that's plenty, because it foams up once you start brushing too.
Yeah.
And Yeah, 2 minutes is the goal, but a little one's not going to give you 2 minutes of brushing. So the
Of
goal is to
course.
just get in, get the areas that you need to get and get out. So by the gum line is an area where you really want to try to brush. Sometimes it helps to kind of hold the lips out of the way on the top. And even kids sort of make their lower lip really tight when you're trying to brush their
Yes.
teeth. So if you want to hold it out of the way with your hand and then brush with another hand, or even have them smile, that way their lips get a little bit looser. Because if you're open really big when you're trying to brush your teeth, your muscles get really tight and it's kind of harder to reach in there. That's a big thing that always comes up. And just try to get the gum line and then the biting surface grooves of those molars. Just sort of walk your toothbrush to the outside, the top side, and the inside as fast as you can.
Right. As quick as you can. That is fantastic
Spend as much
advice.
time on it as they'll let you, but just get those main areas. And then as soon as teeth start touching, what will typically touch too are the molars in the back.
Mhm.
So, well, that leads us into the sequence that teeth come into. We'll get to that. But whenever you notice that teeth are touching, even if you have a little guy, like a 1.5-year-old, start flossing them. The earlier you get used to flossing, the easier that transition will be. They even make little kids flosser sticks, the ones with the
Yes.
U shape, and they come in flavors, they come in designs, they come in different colors. Whatever will motivate your child is the one to pick. And they sell them everywhere, any grocery store, Target, Walmart. Just go to the kids' toothpaste aisle and they'll have a bunch of options there. They have Starburst flavor. They have all kinds of cool ones that, they like to suck the flavor off of anyway. So
Right.
even if you can get that in there at nighttime, you don't have to floss in the morning, but at nighttime, if you can really do good flossing with any teeth that are touching, that's often what parents don't think about because they're so little,
Right.
they just haven't thought about flossing yet, which I get it. I hadn't either. So that's a big thing. And then teeth start coming in around 6 to 10 months old. That's usually when babies start getting their first lower, what are called incisors on the bottom, in the middle, and the front. Even if
Really
those are
cute
touching,
little in the pictures,
yeah,
the little two little teeth that come in. My favorite.
exactly. And also to go off of that, that's not a concern. If teeth aren't in by 6 to 10 months, there's charts that you can find online that will have you nervous about when your kids' teeth are coming in, but just go see a dentist. They'll assure you can usually feel them under the gum. Some kids are just a little bit later. It's kind of like puberty. Some kids develop a little bit later. Some kids are a little bit early. So don't let the charts online make you panic
That's
about
good to
when
know. Yeah. My kids
when
are
your
late teeth kids.
late bloomers, which I always think is better because you have more time when you get your grown-up teeth. If you're a little bit later, you have more time to get better at brushing before you get
True.
all of your final teeth.
Right. Right. And so flossing, is it okay to use the same flosser for your whole mouth, or do you need to be changing them, or what when you're
No, you don't need to change it. Just one flosser a night will do it. And if
okay?
there's any
Okay.
food that comes off on it, just remove it. Wash your hands before you help your child brush because you'll be in their mouth, kind of holding their lips and cheeks out of the way to get there. And then if there's, bigger chunks of food that are coming out, just wipe them off with your
Great.
finger
Okay.
or run it under the sink if you want to. Just get it
Perfect.
clean so you're not reintroducing those chunks of food back in between the teeth.
Right. Sticking them in another tooth.
I mean, and if you're more comfortable with the long string type of floss, you can use that on a child. It's just a little bit more difficult to get both of your hands in there.
Yes.
And positioning, which I could talk all day about this. It brings me to another point. Positioning is another thing that's really helpful. Sometimes if you're trying to come from the front and if your child is facing you and you're trying to brush them like this, their heads are moving around. It's kind of more difficult to do it that way. For younger kids, like they still have a changing table. I think that's a much easier area to brush
Oh,
while they're laying
yeah.
down, because essentially when you get a dental exam, that's what you're doing. You're laying down because it's
True.
easier to see like that. So same thing at home. Try to do it on the changing table, on the floor, on the couch, wherever they can lay down. That helps. Or if not, if you're standing in the bathroom, like on a step stool or something like that, and they're looking in the mirror, come from behind so that you can kind of.
Oh, I like that. And then they
picture
can kind of
it better.
start to see what they'll be doing eventually.
Yeah,
like
exactly.
that.
They can see, they know what's going on, and you just have better grasp that way to be able to
Right,
reach
right.
rather than trying to do this.
I love that. That's great. Okay. I wish I had had all these tips. So moms, listen up because these are awesome tips.
Again, it's never too late.
Right,
They
right.
don't need your help anymore. But I would say flossing is a big deal. And then just kids running away when you're trying to brush, just try to make it a habit. If you have to kind of even sit on top of them on the floor when they're 1 year old, that's a tough time
Right.
to start your brushing. Just kind of sit so that their arms aren't reaching up, or we'll show you the
Yeah.
position that we get into here while we do our exams, that if you have two people at home to help, the little lap exam, that way someone can hold their hands and then someone has more control of kind of their teeth and their head. It's a really good way to do it. So we can show you that at the dentist. Any dentist can show you that. It's a nice way to just get it done a little bit easier.
Yeah, absolutely. And probably give them some peace of mind too, because I love how you said they see your face. And so they know everything's fine. That's
Yeah.
great.
And really push for the nighttime. If it's a struggle in the morning, ideally brush in the morning, but really if you can do a good thorough brushing and flossing before you go to bed, and then try to just have water after that, if you're having any milk or juice or anything like that before bedtime, try to put that before you're brushing and you're flossing. So that way the whole time they're sleeping, they have that nice, clean, healthy mouth.
I love that. That's
Because
awesome.
milk comes up a lot too. If
Yes.
children are going to sleep with bottles or sippy cups or anything like that, and their teeth are never getting a break from those sugars kind of soaking on
Right.
the teeth, that leads you at a higher risk for getting cavities. So you just want to be careful with things like that, trying to do mostly water before any kind of extended period of sleep.
That makes sense. That's great. Oh
And
my goodness. Okay.
even with like snack drinks, like juices or things like that, you can always dilute them. You can do, 3/4 of a cup
Yes.
water and 1/4 of a cup juice, and try to keep that with a mealtime. Try to make any sugary beverage something that they don't sip on throughout the day, because then the teeth are constantly getting soaked in those sugars. I mean,
Right.
ideally, drink water throughout the day. But if your kids drink juice, just try to either dilute it and keep it to a mealtime with just a little cup, or brush afterwards.
I love that because it's great for the budget too. It makes that stretch a little further. That is great. Oh my goodness. Okay. What other tips do you have for us?
Another thing that comes up a lot that moms have questions about, a lot of people come for their first visit once their child's kind of bumped or knocked their tooth or had an accident of some kind. We can always see you then. We'll work you in as an emergency visit. So if anything ever happens, just give us a call and we can always look, even if you're not a patient of ours. But that is one reason it's good to start establishing the dentist early. Bring your child in by the time they're 1, so that way they have a place to go. We call it a dental
Mhm.
home, sort of a place where you go if things happen. And we can always take a look. Know that mouth trauma bleeds a lot. It looks very messy. A lot of times it just looks more messy than it has done damage, which is nice because kids' bones are really soft. A lot of
Mhm.
times when they bump and knock their teeth into tables and things like that, kids are clumsy. Whenever they're hitting themselves and bump their teeth, the mouth kind of fills up with blood pretty quickly and it looks pretty scary. A lot of times you'll see bleeding along the gum line. So you'll think like teeth fell out and it's just kind of
Right.
a gruesome scene, but just take like a wet washcloth and or a wet paper towel, try to clean it off a little bit as much as your child is comfortable with it, and then bring them in right away so we can kind of take a look. If it's something that was just a small fall, you might see just a little bit of blood around the gum line. You could still brush the teeth if that happens. Sometimes kids get little chips in their teeth. It's usually not a huge concern, but we always do like to take a look just to make sure, because
Right.
sometimes teeth will be loose and we'll have to talk about what to do about that. But it just sort of depends on how bad the accident is. We always like to see kids as soon as they've had an injury.
That's great to know. And I love what you said about go ahead and establish the dentist. That way, if there is an accident and they do come in, it's not this first time visit, scary visit all at once. It's okay. Oh, I'm just going to go see where I know where I've already been. That's great advice.
And they do get to know us the more they come in, even if they come in every 6 months, they start to
Yeah.
recognize what's around them, and, they start to ease up a little bit. And then eventually we'll stop using the parent lap, and then they'll be able to move into the grown-up chair. And they like that. It's good confidence for them. So the
Right.
earlier they start, just the easier that transition is.
It's true. They're just little people.
That is true.
That's great. Well, okay. So if there's anything that you could just take a megaphone and just shout it to all parents and be like, hey, this is the one thing it would help your kids' teeth for life if they would just do this one thing. What would it be? Would it be something that you've already mentioned, or would it be something else?
Yeah, I would say the biggest thing is brushing before bedtime.
Okay.
It's difficult to get out of the house in the morning. Everybody's got a million things going on. If you miss a morning brushing and you're doing all the right things, drinking a lot of water, it's not going to be detrimental if you're not brushing your teeth in the morning most of the times. Try to fight for the nighttime one. Just get one really good, thorough nighttime brushing in. And then flossing is so important, because that's when we start taking x-rays of teeth, is when they're touching. That's when we're more looking for is cavities hiding in between the teeth. And just a lot
Right.
of parents haven't thought about flossing in really little kids. So you just have to look to make sure if teeth are touching, you're getting in there with your floss. Those are main things. And just going to sleep with water. As soon as you have teeth, try not to put your baby to sleep with any kind of milk or anything in the crib that they could have overnight.
That's interesting.
Those are
That's good
main
to
things.
know. Good to know. Oh my goodness. Okay, well, tell us about where you're located and all those things. So if our parents want to get in touch with you guys, they know where to go.
So let me see, I have our address actually right here. 57, I just drive here, so don't have the address. 5717 East Thomas Road, Suite 110 in Scottsdale. So right across from the Arizona Country Club.
Oh,
So Thomas
perfect.
and 56th Street essentially. And we also have an orthodontist next door that we work with it's called Arcadia Orthodontics. So if you have older kids, we kind of work with them, and that it works
Oh,
really
that's
nicely to have kind
great.
of a one-stop visit.
Yes, you're not trying to drive to two places and figure out where you're going, and that's fantastic.
Yeah, it's nice to just kind of have a day of appointments, get it over with.
Right, right. Okay, so they come in, they do their first appointment, and then how often after that first appointment, how often should we be checking back in with you and scheduling appointments for?
Most of the time it's every 6 months. And actually what we do here is we'll give you your next appointment card. We'll have already set it up for you at the time or date that works for you to serve as a reminder. You can always change it because nobody knows what they're doing 6 months from now. But every
Right,
6 for most kids, there are some kids like older kids who are in braces where we'll recommend more frequent visits, or if there's certain things we're keeping an eye on or things that we want to follow up more consistently, then we'll sometimes move that to every 3 months. There are some cases where if we're doing special treatments, we'll see it every. It just sort of depends. So that's why it's so important to establish with the dentist, because you don't even know how often you should be coming until you go.
right, right. That is awesome advice. Well, thank you so much for joining us today. Is there anything that you'd like to leave us with? Anything else that I don't want to rush you off if there's something?
Now I know I was trying to get it all out for you
I
because
know
there's
you did awesome.
you get going and you just can't stop. No, but come see us. Come see. And I think it is important for children to see a pediatric dentist. I do think it makes a difference. You do extra training to become a pediatric dentist. Look for a pediatric dentist that's board certified when you're looking for a dentist. That's an extra step that we have to take to become board certified. So, and if you need anything, call us.
That's awesome. That's
Look for
awesome.
a
No,
board certified pediatric dentist for your child. We would be happy to see you here. And yeah.
well, thank you. Thank you so much for your time today and sharing those bits of wisdoms with moms. Cause I wish I had had all that with my oldest, but so my youngest will probably have a lot better teeth than.
Well, I hope it was useful. And
Absolutely.
I'm a mom too. So I realize that what we say and the instructions we give, it's a lot easier to say it than to do it. And, implementation is really hard. So I totally get it. You just do the best you can.
It's true, but I feel like that is one of those things, teeth, it's like they are with you for your life. So you better take really good care of them.
At least that second set is.
Right?
You don't want to go anywhere.
Exactly. Exactly. Well, thank you so much for your time. And yeah, so Arcadia Pediatric Dental, we will put their website and their information below in the comments. And be sure if you have any questions, leave them below and we'll get them to them.
All right.
Thank you
Thanks so
so
much, Kate.
much.
Thanks for having me.
Thank you.